Hello everyone. Tooth identification is very important in the whole discipline of dentistry to number each tooth or identify tooth using notations or numbering system. Tooth numbering system is a very important process. So today we'll be discussing about the various nomenclature and systems which we use for numbering the tooth or identifying the tooth or denoting the tooth so that we can identify the tooth easily. So learning nomenclature is usually the first step in understanding dental anatomy. So because they provide a shorthand system of tooth notation, which is necessary in clinical practice for recording data, for communication, etc. We need a simple system which will differentiate primary, permanent, maxillomandibular, right or left teeth easily, or different types of teeth easily. So before talking about the various nomenclature systems, we have to talk about the dental formula. So each species of animals have a particular dental formula which denotes the type of teeth and the number of each type of teeth present in one half of that particular species, assuming that dentition will be symmetrical between right and left half. Usually we denote the number of teeth, each type of teeth present in each species in one half of the organism. So the dental formula, similarly in humans also, we have a dental formula which will be different for primary and permanent dentition. And this dental formula can be used to differentiate human dentition from that of other species. So the dental formula will be denoted by symbols. The alphabets corresponding to each teeth will be the first letter of that particular alphabet of that particular teeth. For example, I for incisors, C for canine, P for premolar, and M for molar. So, for a primary dentition, the dental formula will be incisors, 2 maxillary, and then we will denote next to the alphabet denoting each type of teeth, we will put a horizontal bar, and above that we will write the number of teeth present, maxillary teeth present in that particular type of teeth, and then the number of below the horizontal bar we will write the number of mandibular teeth. So incisors, there are 2 maxillary teeth incisors and 2 mandibular incisors. Next, C, canine, 1 maxillary and 1 mandibular canine. And molars, there will be 2 maxillary and 2 mandibular molars, which makes a total of 10 teeth in one half of the human. So there will be 10 deciduous teeth in one half of the human being, which makes it a total of 20. Permanent dentition, again, we will use the symbols of I, C, P, and M. And here, incisors, there will be 2, each on maxillary and mandibular teeth. Canine, 1 in maxillary and 1 in mandibular teeth. Premolar, 2 maxillary and 2 mandibular. And molars, again, there will be 3 maxillary and 3 mandibular molars, making it a total of 16 teeth in one half of the person. 16 teeth in one half, making it a 32 on either side. So these are the dental formula. So basically, these are the teeth which is present in human beings. In primary dentition, there will be central incisor, lateral incisor, canine, first molar, and second molar on one half. Similar to that, there will be mirror image on the other side. And permanent dentition, again, there will be central incisor, lateral incisor, canine, 2 premolars and 3 molars, both on the maxillary and mandibular teeth. For human beings, there will be same type of teeth both in the maxillary and mandibular teeth. This is not the case in all the species, but for humans, there will be same type of teeth will be present maxillary and mandibular arch. So before going into the nomenclature, we have to know the concept of quadrants. We will divide the teeth into 4 quadrants. As I said, Each species is denoted by a dental formula under the assumption that the same type of teeth will be present bilaterally in maxillary and mandibular. The right and left parts, the same teeth will be present. And as I said, for human beings, the same teeth will be present in the maxillary and mandibular. Same type of teeth will be present in maxillary and mandibular arch. So we can divide the whole dentition in both primary and permanent into 4 quadrants with the same type of teeth. So we always start this quadrant from the right maxillary quadrant. We always denote right maxillary quadrant as the quadrant 1, and then we go in a clockwise direction. Right, a left maxillary quadrant is the quadrant 2, mandibular left quadrant is the quadrant 3, and mandibular right quadrant is the quadrant 4. For both primary and permanent teeth, we start from the right maxillary quadrant and go in a clockwise direction. So that's how we measure the quadrants. So in primary teeth, in each quadrant there will be 5 teeth, and in permanent teeth, in each quadrant there will be 8. So the different tooth notation systems which have been used are universal notation system, Palmer notation system, FDI system, and the Denmark system. The universal notation system is a system which has been proposed by the American Dental Association in 1968, and this is based on the concept of universal numbering. That is, each tooth will have a particular number or an alphabet associated with it, by which the tooth will be denoted. There will be a single number or a single alphabet by which the tooth will be denoted. So as we have seen with the quadrant, we always start from the maxillary maxillary right quadrant, that's a quadrant 1. And here for primary teeth, we denote the teeth using alphabets, capital alphabets. So starting from the maxillary right end, we start from the maxillary third molar as A, B, C, and extend to the left maxillary third molar, maxillary left third molar. Then we go to the mandibular left third molar, denote it as K, and we proceed towards the right side with the mandibular right third molar being the tooth number T. So that is universal notation system. Universal notation system denotes one particular teeth. For decisions, it is alphabets, and for permanent teeth, we denote it using numbers. Again, starting from the maxillary right third molar, which will be tooth number 1, we extend toward the left direction. Tooth number 16, the last tooth of the maxillary arch, will be left maxillary third molar. Then we come to the mandibular left third molar, which is tooth number 17, and extend towards the right direction. And maxillary third molar will be, maxillary right third molar will be the last teeth, that is tooth number 32. So one number and one alphabet will be denoting one particular teeth. So the universal system of notation, the permanent teeth, as I said, it starts from upper right, upper left, lower goes to the lower left, and lower right. And we use numbers 1 to 32 for permanent teeth. So the advantages of using a universal system where a number or an alphabet denotes each tooth is that it's a simple concept, and each tooth has a unique code. So there is no chance of any confusion between right or left or maxillary mandibular. There is one particular number for each tooth, and once we get that, there's no chances of confusion. Left and right teeth of the same type has different designations. Again, it avoids the confusion. It can be communicated verbally very easily. There is, again, just a number, just an alphabet we have to communicate. So verbal communication becomes much more easier and it's compatible with computer keyboards. So it's easy to type. As we'll see, some of the symbolic designations are harder to type, but here we just have to type in a number or an alphabet. So it's easy, compatible with computer keyboards. Main disadvantage is obviously the difficulty in memorizing the notation of each tool. That is the main disadvantage. And it's also difficult to visualize graphically. It's just a number on alphabet, so it's difficult to visualize graphically as to where the keys will be present in the dentition, the whole dentition. So next system is the Sigmondi-Palmer notation system. So the part, or simply the Palmer notation. Sigmondi-Palmer notation system is a symbolic system, very quite different from the universal system. This is a symbolic system in which a symbol denotes each quadrant. Again, the keys are divided into quadrant, and each quadrant is denoted by a particular symbol, as you can see here. Each quadrant, the upper right, upper left, lower right, and lower left quadrants have been denoted by different symbols. They have been denoted by different symbols. And again, the tooth number is denoted by either an alphabet or a number. So the decimal teeth is denoted by letters A to E. But here, the letters start from the midline as opposed to from the third molar, start from the central incisor, from the midline in each quadrant and extends towards the last tooth. So for deciduous tooth, we use alphabets from A to E, all in all the quadrants starting from the midline. And we have separate symbols for each quadrant. So we couple the symbol for the quadrant with that particular key and denote the tooth. For the permanent teeth, again, the symbols for each quadrant is the same, just that we use numbers from 1 to 8 for each quadrant. So start again from the midline with each tooth denoted by a number, and we couple it with the symbol used for that particular quadrant, and we'll get the notation for the particular. So that is Sigmondi-Palmer notation. It's a very graphical. The main advantages of Palmer notation is that it produces a very graphical image. So the person seeing the notation will immediately get the idea about the quadrant and the arch where the teeth is present. So it's simple to follow, produce a very graphical image, and quadrant symbols are same for both the dentition. So it's easier to memorize it. Disadvantage is that it's incompatible with computer system, and in which that denoting the quadrant will become very difficult while typing it into a computer for records. And it's obviously difficult for verbal communication. It's impossible to verbally communicate using Palmer notation. And there are more chances of error while designating right and left side keys, because the symbols they can get confusing between the left and right symbols. Next system which we most commonly use is the FDI system, or the Federation Dentaire International System. That's the most commonly used system in India mostly. It's a two-digit system which was proposed by FDI, or Federation Dentaire International, and has been adopted by the WHO and various organizations such as the International Association for Dental Research. So it's a the most widely used system for tooth numbering used worldwide. And in this system, again, the teeth are denoted by either numbers from 1 to 8. So use the numbers 1 to 8 for each particular teeth in permanent dentition, and 1 to 5 for primary dentition. But here, instead of using symbols for the quadrant, we use another number to denote the quadrant. For primary teeth, it's numbered from 5 to 8. Upper right is considered as quadrant number 5. Maxillary left is quadrant number 6. Maxillary mandibular left is quadrant number 7, and mandibular right is quadrant number 8. And then, similar to the Palmer notation, we name the tooth 1, 2, 3, 4, 5 starting from the midline. So this is the Palmer notation for the primary teeth. The quadrant number will be 5, 6, 7, 8, and will be followed by the tooth number starting from the midline. For the permanent teeth, again, it will start, quadrant numbers will be there, and there will be the second part will be the tooth number. Here the tooth number will extend from 1 to 8. And here the quadrant numbers are denoted as 1 to 4, starting from the maxillary right and again going in a clockwise direction. The quadrant numbers will be 1, 2, 3, and 4 for the lower right. Upper right will be 1, upper left quadrant will be 2, lower left will be 3, and lower right will be quadrant number 4. So we have to write the quadrant number and again write the tooth number starting from the midline. 1 to 8 starting from the midline, we'll have to write the tooth number after the quadrant number. So the advantages of the system is that it's an internationally followed system in most parts of the world. So there will be lesser communication gap between different parts of the world when we use the system. So only system that makes visual, cognitive, and computer sense. It's easier to communicate. It gives a sense of, even though it's not a common notation, it gives a visual representation of the arts where it is present. It is easier to type. It is easier to communicate the number. It's easier for verbal communication. And it helps to prevent errors when differentiating right and left. Again, similar to area, here also the standard of errors when we try to differentiate right and left or upper and lower arts are less. So it's a very advantageous system, and due to these reasons, it's the most common system of tooth numbering used. Finally, we just have to mention the Denmark system, which is not much used recently. It only has a historical purpose anymore, but it was one of the first attempts at nomenclature of tooth made by Victor Hagerup of Denmark, who devised this system in 1891. So according to this system, again the teeth were numbered from 1 to 8 for permanent, similar to SDI system. 1 to 8 were numbers designated for permanent teeth, and 1 to 5 were numbers designated for primary teeth. And for the symbols of plus and minus were used for maxillary and mandibular teeth respectively. Maxillary teeth were denoted by the symbol plus, and mandibular teeth with the symbol minus. And for denoting right and left side, the symbol was put either in front of the number. If the symbol was put in front of the number, usually referred to as the left side. And if it was put after the number, it's usually referred to as right side. So plus 1 becomes upper left central incisor. 1 plus becomes upper right central incisor. 1 minus becomes lower right central incisor, and minus 1 becomes lower left central incisor. Number of the tooth was denoted as 1 to 8. Primary tooth number was denoted with a 0 in front of. So there will be numbers from 1 to 5 with a number 0 in front of it to denote that they were deciduous teeth. And then everything else plus and minus either in front of the number or after the number were put to show the maxillary, whether it is maxillary mandibular teeth, and to show whether it is right or left. So that is the Denmark system of tooth nomenclature, which was put up by Victor Hagerup in 1891. It is not much used anymore. As you can imagine, it's much more complex than simpler methods which we have discussed earlier. So those are the various tooth nomenclature and numbering systems, which is the basis of communicating and clinical recording of dental procedures and dentistry. So it's the basis for all the dental records.